Ladies and gentlemen, welcome to MedSynapse podcast series. I'm your host, Dr. Nigar, and today we're honored to have Dr. Vishwanath Natesh, a distinguished ENT specialist with extensive expertise. Dr. Natesh completed MS in ENT from Army Hospital Research and Referral, Delhi University, and pursued specialized training in sinus surgery and vestibular disorders management. He is a member of prestigious medical societies such as the Association of Otolaryngologists of India, All India Rhinology Society, European Rhinology Society, and American Academy of Otolaryngology and Head and Neck Surgery. With a prophylactic research background, including 7 publications and active participation in national and international conferences, Dr. Natesh is a recognized authority in otolaryngology. Join us as we explore sinusitis management with Dr. Natesh, a true leader in the field. Before we dive into the discussion on sinusitis and its management, Dr. Natesh, could you please share with our audience what inspired you to specialize in ENT?
So actually, Dr. Nigar, it's a very interesting question. So back in India, when we choose a subject for post-graduation, we have to go through an exam, an entrance exam. And there are a lot of things which influence your, selecting a particular subject. So I chose ENT because during our undergraduation, I found that ENT as a field, as a medical field, as a surgical field, had a lot of potential to grow in the coming 5 to 10 years post my post-graduation. So as we see, it has a lot of subspecialties, ENT itself, and the immense potential for the subject as it is, to advance, to throw up new potential, and the potential for my personal and professional growth was very high. So that is why I chose ENT. Plus, I had an added advantage. I got this subject in my home city, that is Delhi. And during your, post-graduation study, it's a very tough 3 years. So having family support, being with them was always an added advantage. So that is why I ended up choosing ENT.
Thank you so much, Dr. Natesh, for sharing your journey and insights with us. We look forward to learning more from you as we delve into the topic of sinusitis management. Dr. Natesh, to begin with, could you explain the common symptoms of sinusitis and how can individuals differentiate it from other respiratory issues?
Okay, so as we know, sinusitis these days is a very common condition. I mean, in our day-to-day practice, we see patients with sinusitis very commonly. If we go through various studies, various research papers and publications, the present prevalence of sinusitis worldwide is anything between 10 to 30%. Therefore, it is very important for us to understand the symptoms of sinusitis and how to differentiate it from other conditions. So, as per the paper, the EPOS paper, that is European Position Paper on Sinusitis, the cardinal symptoms for sinusitis are nasal blockage. That is, it could be block, it could be obstruction, or it could be nasal congestion. Then a nasal discharge, it could be anterior nasal discharge or post-nasal discharge, which we commonly refer to as the post-nasal drip. It could also be facial pain or facial pressure. And one important sign or symptom is loss of smell or reduced smell sensation in a patient. So these 4 symptoms basically, help us leading towards the diagnosis of sinusitis. Now, as we know, there are different conditions which can mimic sinusitis, and sometimes there can be confounding symptoms when we see a patient. So there could be symptoms related to allergic rhinitis. A simple viral upper airway infection can also mimic symptoms of sinusitis. Then anatomical factors, factors like a deviated nasal septum or foreign body in the nose, especially in children, unilateral symptoms mostly. Then symptoms because of various allergen exposure in a patient, a person who is allergic to certain things, he might end up having the same symptoms. Then there is a condition called non-allergic rhinitis. Again, the symptoms are more or less same. Then there are conditions like rhinitis medicamentosa. I mean, the symptoms of nasal obstruction, nasal discharge could as well mimic sinusitis. Now, this condition, I must say, develops because of overuse of local decongestants, and the patients end up having the same symptom for which they take the medication, in particular the nasal block, the nasal congestion. So then there could be benign and malignant conditions in the nose, nasal cavity, the paranasal sinuses, which mimics symptoms of sinusitis. Then, as I said, we have conditions like atrophic rhinitis, in which, although the nose is very roomy, there is atrophy of the nasal structures, but paradoxically, patients present with, nasal obstruction, pain, feeling of pressure, foul-smelling discharge, also from the nose. So, yeah, in broad, as I said, the 4 conditions which I mentioned for the diagnosis of sinusitis, and the various differential diagnosis of the various other conditions which can produce similar symptoms.
Thank you so much, Dr. Natesh, for explaining the common symptoms of sinusitis. It is definitely crucial for people to recognize these symptoms early to seek the appropriate treatment and to avoid the unnecessary discomfort. Now, moving on to our next question. What are the primary causes of chronic sinusitis, and are there specific risk factors that doctors should be aware of?
So, obviously, yes, there are reasons, there are causes why a patient has sinusitis and why certain other people don't develop this easily. So the primary cause of sinusitis, either chronic, either acute or chronic, is there, and it is mainly upper respiratory infections, mainly viral infections. If we talk of chronic sinusitis, then it could be post-acute rhinosinusitis. Now, if we can classify, if I have to classify acute and chronic sinusitis, so it is the duration of symptoms which help us differentiate acute and chronic. So if the symptoms are lasting less than 12 weeks, we classify it as acute sinusitis. If the symptoms last more than 12 weeks, we classify it as chronic sinusitis. And it is important here to mention that less than 12 weeks and more than 12 weeks, the symptoms have to resolve totally to call them as acute sinusitis or chronic sinusitis. So in between, the patient should not be suffering once the symptoms have resolved. Now, 2 things are important here. The patient has an infection, and this infection leads to remodeling of the nasal mucosa. This remodeling of nasal mucosa leads to a blockage of the ostium of the sinuses. Now, infection, remodeling of nasal mucosa, leading to blockage of sinus ostium. This blockage of sinus ostium is very important in the overall pathogenesis of sinusitis, and in turn, whatever symptom it produces. Then we have one condition which is nasal polyposis, most commonly associated with chronic sinusitis. This condition is an other end of the spectrum of sinus diseases, and generally it is known to be caused because of a systemic inflammatory response to infection or allergens which a person gets exposed to. So now nasal polyps are semi-translucent mucosal swellings. These swellings or these masses, they prolapse into the nasal mucosa and produce symptoms. So this was basically, in short, the pathogenesis. And as far as the risk factors are concerned, there are risk factors related to sinusitis. It is mainly seen in females, mainly seen in persons with immunodeficiency, seen in people who have a habit of smoking, or people even if they don't smoke, but they are exposed to secondhand smoking, people who have a predisposition for allergy. Again, allergy, it could be indoor allergy, outdoor allergy. This allergy, as we define in a person, it is the predisposition, to produce IgE mediated immunological reaction, which again leads to the sequence of events which I mentioned earlier, which can lead to sinus symptoms. Again, if we talk of risk factors which are helpful in avoiding sinusitis, is we have seen in joint families when there are a lot of children around. When they grow up, they are less predisposed. Then a Mediterranean diet, healthy lifestyle, or a healthy diet again helps protect people from sinusitis. Then farm people, when there was not too much of urbanization, people lived in farms, villages. Those places you had incidents of lesser sinusitis. But as urbanization has increased, we have moved away from our natural environments. We have seen that cases of sinusitis, they have increased in numbers.
Thank you so much, Dr. Natesh. Definitely understanding these factors can help the doctors to tailor the treatment plans for their patients and address the underlying causes effectively. Now, moving on to, could you please discuss the available treatment options for sinusitis, both medical and non-medical, and when surgery might be considered?
So again, as I said, the evolvement of sinusitis is post an infection, most commonly a viral infection. So the treatment of the initial infection is very important, and it generally is symptomatic. So we need to treat the congestion of the nose by topical or systemic decongestants. Then for the fever or for pain, we need anti-inflammatory medication. Then again, of topical steroids, intranasal steroids. Most commonly we use mometasone furoate up to 200 micrograms per day. And several studies across the board, several studies across regions, it has shown that when intranasal steroids are added to antibiotics during the treatment of sinusitis, they have always given better results, better symptom resolution, and have decreased morbidity in patients. See, at the end of the day, what do we want? When we are treating a patient of sinusitis, we are trying to reduce the symptoms. We are trying to open up the sinus ostia. We are trying to reduce the morbidity of the patient and improve the quality of life of the patient. So antibiotic along with intranasal steroids should be chosen for better results. As far as antibiotics are concerned, amoxicillin clavulanic acid or a second generation cephalosporin should generally be used as the initial treatment. If somebody is allergic to penicillin or amoxicillin clavulanic acid, azithromycin or clarithromycin can be used. Now, as far as the alternative treatment modalities are concerned, so it involves around our hygiene, a good hand hygiene, good personal hygiene, avoiding allergens, healthy diet. All these things, they help us in avoiding sinusitis. As far as the surgery is concerned, surgery is reserved for cases where the response to medical management, appropriate medical management over a period of 10 days to 2 weeks doesn't work well, or the patients, in spite of getting appropriate treatment, end up with complications like collection of purulent discharge in the sinuses leading to persistent fever, unilateral pain in the sinuses, most commonly manifesting as facial pain or headache, or even orbital complications. So for this, the standard treatment is obviously FES, which is functional endoscopic sinus surgery. It aims to restore the sinus ventilation, to open up the sinus ostium so that the drainage of mucus is properly managed. So overall, if the patient has not responded to the medical management, we go in for the surgical management. But thankfully, with more awareness these days, with availability of good antibiotics and at our hands, and obviously patients being very aware of the symptoms these days, they seek medical management quite early. And therefore, we have seen in cases where we come across patients with acute sinusitis, most of them, the majority of them, respond very well to medical management. Obviously, the ones with complications, the ones with chronic sinusitis with polyposis, uh, are, they need the surgical management and are accordingly offered functional sinus surgery, which takes care of their symptoms.
Now, what about when it comes to lifestyle changes? Are there any lifestyle changes or preventive measures that individuals prone to sinusitis can adopt to minimize the frequency of episodes?
So, everything these days, is related to our lifestyle. What we eat, what we think, how we carry on ourselves in our day-to-day life, where we live, our indoor environment, our outdoor environment. The disease is because of our interaction with our environment and how we behave or how we react to the environment. So, as I had mentioned earlier, lifestyle changes like good personal hygiene, good hand hygiene, does go a long way in protecting us from infections leading to sinusitis. Then vaccination, especially if I may mention here, flu vaccine or pneumococcal vaccine. As per the guidelines, as per the requirements, if vaccination is done, people take vaccines. These reduce the number of infections we have, or these reduce the severity of the infection. Overall, giving us a cushion from sinus infections. Then not smoking or even being not exposed to second-hand smoke does help a lot. Use of air purifiers, because these days there is a lot of disconnect from the environment. We live in insulated houses, air conditioned. We have humidifiers, we have heaters, we have air conditioners in places. So that has changed a lot of environmental parameters, and therefore using air purifiers, having a healthy diet, exercising, again breathing exercises, walking, simple walking, all of these, if we can accommodate in our day-to-day life, it does help a lot in protecting us from sinus infection, or for that matter any upper respiratory infection.
Dr. Natesh, lastly, how does weather contribute to sinusitis?
Weather does play an important role. As I had mentioned, viral infections are the primary cause which offset or which trigger off upper respiratory infection leading to sinus infections. So we have seen year after year, the viral infection hitting us clockwise. I mean, precisely as weather changes, especially if you see in winters. So there is humidity, there is temperature. Both humidity and temperature, they do affect a lot how the viruses get transmitted, how they affect human beings. Again, presence of particulate matter, PM10, PM5, PM2.5, all of this affects the sinus infections. Then we have allergens, we have air pollution, smog, dust, chemicals, organic materials. All of this, leads to sinus infection, and a particular weather, the presence of airflow across a region, the presence of particulate matter, all of this combined together, they have an effect on the seasons, on a particular time, particular month, when the viruses become more active and we are more prone to infections. Now we know influenza. I mentioned about the flu vaccine. Influenza, this viral infection is very common during the months of October, November, December, extending up to February. So the low temperature, the humidity, both of these, they combine together and produce effects which lead to the virulence of the virus increasing and human beings being more prone to infections.
Thank you so much, Dr. Natesh, for generously sharing your expertise and knowledge with us today. Your insights into the field of ENT and sinusitis management is truly appreciated, and we value your contribution to our discussion and commend your dedication to advancing patient care. Thank you so much.
So thank you, Dr. Nigar. Thank you to you and your whole MedSynapse team. It was a great honor and pleasure being on your board. And I hope I was able to answer your questions in a simple manner, which will benefit people who cater to this information. Thank you so much.
Definitely, Dr. Natesh. Thank you so much once again. And we're looking forward to many more interesting podcasts together.
Thank you. Thank you. Good day.
Good day. And to our esteemed audience, we extend our heartfelt thanks for joining us on this informative journey. Your participation and engagement enriches our discussions, and we look forward to contributing to explore important topics together in the future episodes. Thank you and goodbye.